Okay.
Hello, welcome. I'm Fiona Godley, Editor-in-Chief of the BMJ, and I'm very pleased to be hosting this special event to discuss moving towards a COVID elimination strategy for the British Isles. And for those of you whose geography is as vague as mine, I looked up the British Isles, and it constitutes the islands of Great Britain, Ireland, the Isle of Man, the Hebrides, and over 6,000 smaller islands. And with me, we have a stellar panel of discussants representing the 4 UK nations and the Republic of Ireland, and including members of UK's or attendees and members of the UK's scientific advisory group SAGE, and also from Independent SAGE, from whom the proposal for a change in strategic direction has come. We'll begin with a brief outline from Gabriel Scally of the proposal from Independent SAGE for a new overarching strategic objective to achieve the elimination of SARS-CoV-2 from the British Isles. Then we'll open up for discussion among the panel. Is such a vision possible? And if so, is now the time? And what would be needed to make it happen? And we'll then take some questions from the press and we'll close at 3:15. So let me quickly introduce our panel. I'll do this by country. So from England, we have Graham Medley, Professor of Infectious Disease Modelling at the London School of Hygiene and Tropical Medicine and a member of SAGE. We have Susan Michie, Professor of Health Psychology and Director of the Centre of Behaviour Change at UCL, a participant in SAGE and also a member of Independent SAGE. We have Jeremy Hunt, Chair of the Health and Social Care Select Committee and former Health Secretary for the UK. We have Devi Sridhar from Scotland, Professor and Chair of Global Public Health at the University of Edinburgh and a member of the Scottish COVID-19 Advisory Group. Also from Scotland, we have Vital Katikareddy of the University of Glasgow, who is co-chair of the Scottish Government's Expert Reference Group on Ethnicity and COVID-19 and an honorary consultant at the Public Health Scotland. Also from Scotland, we have Dr. Philippa Whitford, a breast surgeon, MP for Central Ayrshire and SNP health spokesperson in the House of Commons. From Wales, we have Dr. Ruth Hussey, former Chief Medical Officer for Wales. And from Northern Ireland, we have Colm Gildernew, Chair of the Committee for Health, Northern Ireland Assembly. And from Ireland, we have Michael Harty, a GP and former independent Member of Parliament and recent Chair of the Joint Oireachtas Health Committee in Ireland. And finally, three from iSAGE, we have Sir David King, who's the Chair of the Independent SAGE Committee and former UK Chief Scientific Advisor. We have Christina Pagel, Professor of Operational Research at UCL, and Gabriel Scally, who is Visiting Professor of Public Health at the University of Bristol. That is our panel. I'm now going to hand over to Gabriel, who's going to outline his proposal for a change in strategic direction. Gabriel.
Thank you very much. We've arrived at an important point in this epidemic in these islands, whether you call them the British Isles or Britain and Ireland. What they have in common is that we have that island advantage. And this paper sets out how we really should take advantage of that island status. The firm measures that have eventually been taken across the UK have succeeded in curbing the enormous death toll. But what they've not succeeded in doing in much of the UK is curbing the virus. And Independent SAGE has seen no evidence that the government has a considered strategy for the next stages of handling the pandemic in the UK. Their current approach, contained in Our Plan to Rebuild, the UK government's COVID-19 recovery strategy, even its very title seems to ignore the fact that as far as the virus is concerned, the job is only half done. It's clear that the government has consistently failed to heed broad-based scientific advice, including that from the World Health Organization and the European Centre for Disease Prevention and Control. And similarly, the government does not appear to have learned from the experiences of other countries that have been successful in achieving elimination or near elimination of the infection, and prominent amongst many of those are, of course, islands. The position is, however, not the same across the UK. Northern Ireland and Scotland are both having days in a row without any deaths and having very small numbers now of positive cases reported. Wales had its first day of no deaths yesterday, and similarly their number of cases is falling. England, however, the level of cases, positive cases, remains high, and the government strategy appears to be one of containing the situation at its current level and dealing with any outbreaks, but that, to our mind, is inadequate. The Republic of Ireland deserves to be part of this discussion, of course, because it contains a 310-mile land border between the UK and the Republic of Ireland, which poses its own unique problems in many ways, of course. But when it comes to the dealing with COVID-19, it should be factored into the equation and as an impediment and rather than a solution. So the Republic of Ireland needs to be involved in this discussion. And the Republic of Ireland has also had many days with no deaths and small numbers of cases. They went into social restriction before the UK, have had from the very beginning an active find, test, trace and isolate system. And I was pleased to note that from today, the Republic of Ireland has an operational app available to its whole population, which I'm sure the Prime Minister will be delighted to hear. What we in Independent Sage are arguing for is that we should look at the issues of control and eradication. And we postulate that control would represent 1 new case per million population per day on average. And that would, to our mind, be a definition of bringing the virus under control across the whole of the UK. So that would mean 56 new cases a day for England, 5 a day for Scotland, 3 a day for Wales, and 2 for Northern Ireland. We're not there yet, but certainly Scotland, Northern Ireland, and increasingly Wales are heading absolutely in the right direction and within a quantum of being there. And our strategy for getting to what we hope would be a zero COVID situation across the islands of Britain and Ireland has 5 planks to it. First, fully develop the find, test, trace, isolate, and support programs in all of the territories. And Independent Sage has already produced a report on find, test, trace, isolate, and support. And we believe that there is some distance to go, particularly in England, before there is a proper system in place. Our second plank is restricting the loosening of lockdown measures until in control of the outbreak. And we were particularly concerned about the opening of schools and about some of the later changes, particularly around the availability of alcohol, and particularly because of the absence of the find, test, trace, isolate, and support mechanism. We also believe that there needs to be a mechanism actively to contain and suppress completely and localize flare-ups in COVID-19 infections wherever they happen. And we also believe that the mechanism should be clearly described, it should be tested, and that there should be simulations of it take place so that everyone understands what is going to happen as we deal with inevitable flare-ups. A key part of dealing with the situation as we go down to very small numbers is to restrict incoming or outgoing personal travel internationally and within Britain and Ireland where necessary. And this has been seen to be necessary in order to maintain control in countries across the world. And a final plank is a systematic public information campaign stressing that things are not back to normal, reinforcing the messages about social distancing and emphasizing the importance of people coming forward for testing. And we believe that the UK government is not prepared to accept this advice, based as it is on the best scientific understanding of the pandemic. It must, as a matter of urgency, outline its strategic plan for the rest of the period of this pandemic and the analysis and advice upon which such a plan is based. Thank you, Fiona.
Gabriel, thank you so much. Wonderfully clear. So responses, please, from others. Is this too early in the UK's epidemic? What would need to happen to get us to the place that Gabriel is setting? What is indeed the UK strategy, and what can we learn from other nations? I'm going to ask Philippa Whitford first for the view from Scotland.
Well, I actually asked Matt Hancock about his strategy going forward in the urgent question we had earlier, but didn't get any kind of detailed answer. I think the description of economy versus health is false. In actual fact, if you completely eliminate and shut down the virus, we would have more freedoms and not less. And I think that hinges, as Gabriel talked about, on the test, trace, isolate, the ability to identify people, the ability to find them and their contacts, and then isolate them so that we break the chains of infection. It's obviously what the World Health Organization promotes and what we all wish we'd been in a place to be doing back in February. We've had a case in Dumfries and Galloway, an outbreak. That seems a slightly over descriptive term for 12 people in Dumfries and Galloway in comparison with what has happened in Leicester. But they have all been traced. The workplaces have had mass testing and no new cases have been found. And so the limitations on distant travel has actually been released today. So we have gone through our first tiny little outbreak, and I find it reassuring we were able to find an outbreak that small and shut it down. And I think that's utterly critical to doing that. And for those of us in Scotland, obviously the Scottish government, advised by Devi, are taking a zero tolerance approach to COVID circulating in the community. But the point about avoiding importing cases, number 4 in Gabriel's list, is something that at the moment is not fully under our control. The easiest way to do that is right across the UK and Ireland to drive down the cases and then test on arrival or quarantine people coming in and out. It's very difficult to do that as a tourist nation, but we can't afford to end up back where we were in the middle of March.
Thank you very much indeed, Philippa. Moving on to Colm Gildernew in Northern Ireland, your thoughts? You're on mute, I think, Colm. That's fine, yeah.
Okay. I suppose part of the unique, and it's been alluded to there by Gabriel, part of the unique problem or difficulties, but also opportunities we have is that we have a border and there are currently two jurisdictions. So I think one of the unique challenges for us would be to ensure that coordination is taking place right across the island. We are in a situation, and the Minister has advised the Health Committee here that there is a memorandum of understanding in place, and there is ongoing work between health ministers, both sides of that border, to ensure that data is being shared, that there are common public messages, and indeed, as referred to by Gabriel, the tracing app, which has been launched in the South today. The Minister here has advised the committee that he is working on a similar app which will be compatible with that in the South, and we're hoping that will be launched here in July. So I think we need to kind of maximise our opportunities and minimise any of those potential threats that are caused by any potential for miscommunication, because obviously this virus is absolutely no respecter of political borders, and where we have an unbalanced approach either side of the border, you could see ongoing transmission being driven by that. So we think that's a key factor for us. And indeed, we have heard expert evidence to that effect to the committee of the need to treat the island of Ireland as a single epidemiological unit. And for us, I think that's something that would be we've heard significant evidence of the benefits of that.
Thank you so much, Colm, for those good comments. Michael Harty from Ireland.
Thank you very much, and thank you very much for the invitation to speak at this group. I think in Ireland we introduced quite restrictive measures on the 17th of March, and that was a little later than some countries, and I think a little earlier than the UK. And I think that has had significant benefits to Ireland. For instance, yesterday we had no deaths in Ireland with a population of 4.9 million and only 4 new cases. So we effectively have brought the virus under control. Obviously, the virus is not eliminated. So what's happening in Ireland at the moment, the main items of discussion are how do we deal with foreign travel? How do we open up foreign travel safely? At the moment, we have a voluntary quarantine, if you like, where people who come into the country have to identify where they're going to stay and self-isolate for 14 days. That is being policed partially. Unfortunately, 50% of those who come into the country don't respond to the follow-up call, so it's not actually 100% effective. But nevertheless, there is the attempt to restrict movement when people come into the country. Also, our government is recommending that people do not travel abroad for holidays, only travel for essential reasons. And that is not mandatory, it's a recommendation. In the next number of weeks, we're going to publish a list of countries where it's going to be safe to travel, that there will be an air bridge between Ireland and other countries which have a similar level of coronavirus cases. The other issues that are being discussed in Ireland at the moment are how do we open our social venues safely? We have opened restaurants. Which can serve alcohol, but we haven't opened our pubs yet. And that is going to be reviewed on the 20th of July. There is an anxiety that once you start opening pubs, people, when they take alcohol, obviously lose their inhibitions, and social distancing becomes very, very difficult. And the other main issue here, of course, is how do we open our schools safely and maintain social distancing. As has been referred to earlier, we have developed and opened today a contact tracing app, and 350,000 people have downloaded that app since it became live this morning. So it's just one more element of how we contact trace. And we have had a very robust contact tracing system in Ireland from the beginning. And we have the capacity, if needed, to do 100,000 tests per week. It has never reached that requirement, but that capacity is there. And as we move into the winter, we expect that there will be an increase in cases as our restrictions are lifted. So we are trying to build capacity to deal with contact tracing and to eliminate the virus as soon as possible. Our number is between 0.5 and 0.8, and we hope that we can keep it under 1, of course.
Michael, thank you very much for that. Moving on then to Ruth Hussey in Wales.
Thank you for asking me to join this meeting. I think Wales has taken a careful and considered approach to the restrictions, and only this week, in light of the change in the data, and as Gabriel said, 0 deaths for the first time yesterday, has started to open up and remove the restriction on travel beyond 5 miles from home. So I think a steady, careful response to the virus, and many measures, similar considerations that have already been described by others. I think the issue now is we have a window before the winter to decide which way we want to go. So I think this is a really important conversation to be having, and I really support the suggestion in the paper, which is this has to be a public discussion. And I think to do that, we have to set out what is a credible approach to zero COVID. What would it involve? And how we engage the public in understanding what would be required of them in achieving that ambition. So I think this is really timely. I don't think we should wait until the winter and be constantly battling outbreaks and so on as we go towards, other respiratory illnesses emerging at that time as well. So really welcome it.
Thank you very much, Ruth. And I should say that the paper that Gabriel was speaking to is available on the Independent Sage website. Jeremy Hunt, if I could come to you, I wonder, is the current level of deaths in England acceptable? And if not, why is the government accepting it?
Well, I don't think it is acceptable. And I very much agree with the central point in Gabriel's paper that we should be aiming for 0 infection and elimination of the disease, because that is basically the approach taken in countries which have a SARS strategy as opposed to a flu strategy. And those are the countries that have overwhelmingly been the most successful in tackling coronavirus. My sister lives in Beijing, and she flew back to Beijing in the middle of lockdown. And just to give you an idea of the contrast, she was escorted from the airport in Beijing to her home by Ministry of Health officials, and then put into her home for 2 weeks quarantine. The door was sealed, and she had a police car sitting outside her house periodically. And I'm not saying we go that far in this country, but I just think it's an indication of how serious they are in the countries that have had to deal with SARS about stopping at the root every possible source of infection. I think the central problem we've got is that we have adopted global best practice in terms of test and trace, but at a point where we were getting about 3,500 to 5,000 daily infections, whereas Korea, Taiwan, Singapore did it when they were getting sort of between 10 and 100 daily infections. And the result is that we're picking up a high proportion of the people who are testing positive through the official channels, but we're not picking up the asymptomatic transmissions, which is about 2/3 to 3/4. So the central issue is how we pick up a greater proportion of the daily transmissions in order to feed them into the test and trace and isolate system. And I think if I was doing this from scratch, in fact, I advocated for the kind of localized approach that you talk about, Gabriel, in your paper. I'm not sure I would tear down the system we've got now. I would prefer local authorities to be in the lead. But we have now got a centralized test and trace system, but I would like local authorities to have control of the testing in their areas, at least the testing relating to the test and trace program, so that they can integrate the testing better into the tracing program. And I think
Jeremy, can I just? Oh, sorry. Yes. I was going to say, do you you're joining Gabriel, I suppose, in calling for a zero COVID UK, and I wondered why you think England isn't following the example of Scotland and Ireland, and do you think we will have thousands more deaths in England unless we do that?
Well, as Philippa said in the House of Commons today, I mean, the projection is that we will. I don't think the government would say that it's not going for a zero COVID England strategy. It's just that I think that we need to be doing things that we're not doing at the moment in order to get there. And so the final thing I was going to say, I did go on a bit, the final thing I was going to say is the bit that isn't actually in your pillars, Gabriel, which if we're going to catch 2,000 to 3,000 people every day who are not being picked up by the test and trace system, I think the only way you can do that is by some kind of mass testing program in the places that are most likely to have the highest levels of prevalence. So my reason for advocating weekly testing for NHS and care home staff isn't simply about making them feel more relaxed about going to work and not feeling they're going to be infecting their patients. It's because those are likely to be the highest prevalence areas. I would also add to that groups like taxi drivers who have a high prevalence. I would add to that airport arrivals if we don't have a quarantine system. So I think there are groups of people who a mass testing program could be used to pick up asymptomatic transmitters. And that, I think, is the big next step that we need to be ambitious about.
Thanks, Jeremy. I'm just going to, I'll come back to you again if I may, because I know you've got to go and I don't want to make the most of having you with us. But I mean, Chris Whitty had suggested in comments at the final press conference that he would be surprised and delighted if the current level of deaths for next spring was not at the current level. He's expecting it to continue, which projections suggest 27,000 more deaths in England, or is it the UK? I'm not sure. But anyway, a large number of additional deaths. I mean, do you think that's a morally acceptable approach for the UK?
Well, I think we just have to be careful, because I don't think Chris Whitty, look, I've disagreed with Chris Whitty publicly on his strategy. And I call for lockdown to be much earlier. I call for test and trace right from the start. I call for a zero tolerance approach to the virus when there were people arguing for herd immunity. But I don't think Chris, for one moment, wants believes there is a minimum acceptable level of transmission. It's just that I think if we're going to catch the asymptomatic carriers, we've got to be prepared to do things that we're not currently planning to do, because we're only feeding between 1/4 and 1/3 of the people who get infected into the test and trace program.
And people have sort of wondered whether the UK is still secretly or I don't know, unwontedly aiming for herd immunity. Is herd immunity still on the cards? What would you say the UK's strategy is at the moment?
Well, I don't think we are aiming for herd immunity, but because our mindset was around tackling flu pandemics, there was a sense that basically it would be impossible to hold the prevalence rate of this disease below 50% of the population, and ultimately 60% catching it was an inevitability, even though at that time China, where they had the worst outbreak in the world initially, was managing to hold it below 1% of the population, even in Wuhan. So we had that mindset that this was a futile exercise, and that is why we took so long to really embrace test and trace, because ultimately we thought once community transmission has got beyond a certain point, there's just no point. And I think, has that mindset changed? I think it has changed. So I don't think there's anyone who's actively, who's resigned to herd immunity. I don't think anyone wanted herd immunity, but they were sort of resigned to it being the only way ultimately we can deal with it. But I think, we've got to go further. And if we're actually going to stamp out this virus ahead of winter, we've got to look at mass testing programs. For example, when you have cities like Leicester, Barnsley, Bradford, should we just say, once you get to that level, okay, we're going to test everyone in Leicester over the next 3 days, every single resident, as a way of trying to control the virus? It's those kinds of things which I think we should be embracing.
Jeremy, thank you very much indeed for joining us. And I'm going to move to Graham, if I may. Graham, you're a member of SAGE. Can you just tell us, has SAGE discussed this? And also, could you address the issue of whether herd immunity is still, part of the underlying strategy in the UK?
Thanks, Fiona. So just thank you for inviting me, and I, really welcome the chance to have this kind of public debate. I think it's absolutely necessary to decide the strategy, coordinate, in a way that everyone understands. So I'm here as an independent. I'm not representing SAGE, but I'm here as somebody who's worked on elimination programs in the past. And I think there are kind of three basic pieces of advice or things to think about before embarking on elimination programs. One is it technically possible? And I think the answer may well be yes, but it's unclear. I think Jeremy Hunt raised his asymptomatics as being the biggest challenge. And if we could find some way of resolving that, then I think it is potentially possible. That might mean, though, we spend the summer locked down rather than the winter locked down. But that's I don't think that's necessarily a reason not to do it. The other is the geopolitical coordination, which people have already talked about. I think, though, you have to look beyond the islands, beyond the British Isles. There's an awful lot of normal traffic between mainland Europe and the British Isles, and I think it's hard to see that it would be just possible within the British Isles without looking to see what the strategy was in the rest of Europe. And if there was a European-wide elimination strategy, then that would make it far easier and far more attainable. And then the final thing is to note that if you set a target, and an elimination is a target of 0, then you have to have a real political commitment to it, because you will fail. There will be times on that process, and all programs of elimination and eradication hit problems that they didn't anticipate and hit failures which have to be overcome through a political commitment to want to achieve this. And that's partly why the geopolitical situation is so important, so that everyone shares that commitment. But it also creates, and this is tricky, a perverse incentive, because the only way of resolving this disease and eliminating it is to find it. And that finding it means you have more cases. And so you've set a target of 0 cases, but the way of achieving it is to find all the cases. Then you have to be very careful about the way in which you set that system up, because somebody somewhere is going to be told that they failed for not having 0, and somebody somewhere is going to be congratulated on finding the cases that are actually there. And so I think we just have to be careful before setting out to do it, that we understand the potential pathways and learn from the experience of other diseases.
Thank you very much, Graham. Debbie, if I could come to you, you've been advising the Scottish Government this issue about asymptomatic capture. I mean, how realistic is that in settings like, well, in Scotland, but also across the UK?
Yeah, and I'll join Graham in saying that I'm speaking, I guess, as an independent academic who's been looking at this for many months since January. And my sense is that it is indeed feasible if we see elimination not as zero forever, but that getting out of community transmission, clearing cases from communities, and just dealing with imported cases as they come along. And the reason I think that we've all gotten to this point is it's the least worst path out of the current situation. We have a virus that's too dangerous to spread through a population, not only because of the mortality, but because of the morbidity it causes in healthy young adults. And we're seeing this increasingly. I think that's going to be the story of COVID, not about the deaths. We also see that immunity may not even last. The antibody tests have been incredibly disappointing, and all we can hope for is that there's T-cell immunity or parts of the immune system that we're not capturing through existing serology studies. And so that's also, I think, means that what other path is there going to be if there's no lasting immunity? And we can't fixate on mutations because it could happen, but we're not certain on that. And so it leads to a certain window of time to push for this. And I think it is indeed feasible if we take elimination not as zero forever, but actually just a constant push to zero and finding clusters, especially if you can isolate those at borders and at where they're imported, which obviously means islands are better off. So I see New Zealand as a success. Others say like, oh, look, they had a few cases. I said they caught them and they're going to hold them off. And they can probably hold them off till there's a travel bubble formed with other countries, or till there's a vaccine, or till there's a treatment, or until we know more about immunity. And I just wanted to guess end by saying the reason I also think we need to take these measures is the pandemic is taking off across the world. I think people think it's over, but it's just taking off in countries. Every day new records are being set. So what countries can do and governments can do is protect their citizens and their residents from this storm. And the way they can do that is to use their borders, clear the virus, and then protect at that level. And it doesn't mean shutting off forever. The international part is the hardest, but it means forming travel bridges, quarantine. But I think those bridges need to be formed with high-performing countries, because then you have the risk of constant inflow of cases. And I mean, Scotland has been remarkable. I mean, to see the progress that's been made. Today, 2 new cases, yesterday 4, no deaths for several days. It means obviously there are community cases not being caught, but considering everything, those numbers are remarkable, and the hospitalizations coming down. And I think the summer is the time. And I think we've learned a lot about lockdowns, meaning we don't need to put everyone back in their homes. We know outdoor transmission is minimal, but actually looking very strategically at which parts of the economy do you open, and keeping the idea of schools as the target. We want to get schools back full time, and that's people can buy into that. And saying if we want schools back full time, teachers back, kids back from all families, including multi-generational ones and those with parents who are having health conditions, you've got to clear the virus. And that might mean some pain in the summer, but if we can go into winter without avoiding a second wave and to learn from what's happened in America and Florida and Arizona and Texas and not repeat those mistakes, that is the political objective. But I mean, I guess what I would say to the government is to make this openly an objective. Say to people, this is the strategy, because right now there is confusion, and it's about the economy coming first. It just seems, whack-a-mole is being suggested, local lockdowns. You've got to say what your objective is, form your game plan, and then figure out how you're going to get there and take people along with you. So I'll stop there.
Thank you, Debbie. That's fantastic. Christina, can I ask you then, and maybe this is a general point to raise with others, so please feel free to join. Is England doing enough, Christina? What more should England be doing?
I don't think we are doing enough. I mean, we're opening up spaces, but we haven't accelerated our control of the virus. We haven't got yet the test, trace and isolate system that we need while we're relaxing restrictions. And it just seems to me like controlling the virus in the absence of a vaccine is like balancing on the head of a pin. And the more background level of infections you have, the wobblier you are, and the more likely you are to fall off, and the harder it is to get back on. And so the more we can drive down the infection through finding cases, testing them and isolating their contacts, the easier it is for us to balance on that pin. So, I mean, I really, really want the English government particularly to kind of drive towards zero COVID in the way that Northern Ireland and Scotland have been doing, and Wales.
You mentioned in the thing I've just seen from you about the numbers across the various 4 nations. I mean, do you want to just share those? Because I think that's rather interesting.
Yeah, so I just had a look from Friday the 4th of July, the number of cases, and compared to what Gabriel was suggesting was control, which is 1 in a million per cases. In England, we were at 10. In Wales, it was 11, but the numbers have come down since then. It was 2 in Scotland, 0 in Northern Ireland, and 2 in Ireland, but that was a slightly older figure because I didn't have the 4th of July figure for Ireland. So you can see that Scotland, Ireland and Northern Ireland are really close to getting to that level. England and Wales are a bit further away, but Wales's trajectory seems to be slightly steeper down than England. So, England's behind.
Thank you very much, Christina. Susan, what do you feel? Is England doing enough?
Well, as a behavioural scientist, I'd like to bring in the question of human behaviour. And if the find, test, trace, isolate, support system is going to work, and it has to work if we are going to achieve COVID zero, then we have to pay attention to what people need to do at every stage of that. And there are serious holes from the data that we have got so far. People are not recognising the symptoms well. The vast majority are not, even though they think they are. They often don't know where to get tested, how to get tested. Many aren't providing contacts, and there's a real issue of trust. One really has to trust in order to provide contacts who might have to be isolating with considerable financial and accommodation loss to themselves. And then finally, they do need to isolate. And what I've been very struck by from the government is the word isolation is hardly ever used. But if we don't have isolation, the whole system falls down. And in order for people to isolate, they do need to have somewhere to isolate. And there are no plans, as far as I know, for what I presume is the great majority of the English population who haven't got houses big enough that they can comfortably isolate within and may need other accommodation, and also do not have the kind of incomes that allow them to pay for that. There are also a lot of people we know who haven't been isolating because they've had to go out to work because they need money to live on. And that's another issue that the government needs to do. They need to have clear plans, communicate that clearly so people know that they won't be financially penalised for isolating. So that's part of the issue. And then the other part is that if we're going to have local restrictions and other restrictions where we're asking people to give up freedoms yet again, then there has to be really significant levels of trust in the government that's asking them to do that. And we know that a lot of trust has been lost in terms of the government's handling of the pandemic. This needs to be built up very, very rapidly. So with local restrictions, for example, with all of this, there's an issue about who's making decisions. We do need local bodies participating at every single stage in collecting the data, in receiving data, in making decisions, in being engaged in the planning. And so that proper consultation and proper plans for the eventuality of local restrictions, which does mean sharing data so everybody can see where the next restrictions might need to happen. So there's a lot that needs to happen, much more public discussion, much more honesty and openness in communication.
Thanks. I'm going to come to Christina in a minute. I just want to bring Vital in because you haven't spoken yet. Vital, tell us your reflections from Scotland. And you've been advising the Scottish, or you've been involved in advising the Scottish advisory group on ethnicity and COVID. So tell us your thoughts on, Scotland is doing well, you say, and England less well, obviously.
Yeah, so the first thing I'd say is I think the report's really important, and aiming for a zero COVID British Isles is crucial. I do think that thinking about this as an inequalities issue is going to be really important as well, and probably even more important in order to achieve a zero COVID British Isles. So it really means that we need to be getting the messaging right and actually reaching all communities in terms of knowing what they're expected to do, understanding the symptoms, having trust in the contact tracing systems and engaging with those. At the moment, I'm not sure we've really kind of met those challenges yet. So I think that's probably going to be a really essential next step if we are to achieve a zero COVID British Isles.
Thanks a lot, Vital. Christina and then Coram.
Yeah, I just wanted to follow up on what Susan was saying about test and trace and isolate, which is that Baroness Harding, who runs test and trace, was giving evidence to the House of Lords the other day. And she said that they've been doing surveys of contacts And actually people were saying they found it very difficult to isolate, they didn't have the money, they didn't have the space, and that they didn't really take direction from a text, and they needed the personal contact. And so, you know, our own government's test and trace head is saying we need these extra things in place to get people to isolate.
Thanks, Christina. Colin.
Yeah, I was just taken actually by an overlap of what Susan, Vital and Christina were saying there in relation to community engagement. And this is also something that our committee has addressed on many occasions. We would have a significant population of people who have come to this country in recent years to work both north and south. So that community or those communities are dealing with particular issues around housing. They're normally in much higher density housing. They're already starting out from a language disadvantage. We also have shades of Brexit and uncertainty around security of tenure within the country. So it's very important. It's very important, I think, that all of these systems are based very much in public health. But we have also found that not only are those issues, and indeed the low pay and the inequalities are prevalent there as well, but you also have then the further complication where very many of these people are working in work settings which are highly congregated. A lot of them working in meat factories where we know there are particular problems, and also in care homes. And they would genuinely struggle to apply any type of isolation. So I think that's probably an area where we do need to look at. We have recently got a commitment from the department, and they have published guidance in a range of languages. But I think it needs to be more of a hands-on, reaching into those communities, engaging with them directly, and reassuring them and supporting them in to the degree necessary.
Thanks very much, Colin. Philippa.
Well, we went through the whole fight at the beginning of the epidemic about people being asked to isolate for 2 weeks, but not getting statutory sick pay. And it took a long time to get recognition that in some people's contracts, they don't get any sick pay at all. And even if you end up on sick pay, it's kind of £95 a week. So, you know, it's very hard for people to be asked to deliberately take themselves out of work, out of society, stay in their bedroom away from their family without both, you know, the support like shielding people have had of food, medicines and funding. I mean, literally, there are still groups of workers who have not had any support in the last 5 months. Freelancers, different groups of self-employed. So we need to make sure that as we go forward, whether it's a local lockdown or an outbreak, that people know they will be financially supported. And I think the other thing that Susan had talked about and others is trust. So I think the public conversation, I think it's a pity that the UK government have stopped doing their kind of press conferences. I know they weren't always everyone's cup of tea, but you know, the First Minister here, people do watch it. It's very straightforward, and it gives the chance for government to explain things not through the lens of media, whether that media is supportive or antagonistic. So I think we need to have quite direct lines of communication, but people need to know if we ask them to stop working for 2 weeks, they'll be able to feed their families.
Thank you, Philippa. I've got a question here from Twitter, I think. It says, or from YouTube, how does the data showing the number that have been tested per day being withdrawn from publication assist or distract from containment? So basically, that number was available, the number that have been tested per day, but is now no longer being published. Who might want to respond to that? Gabriel, I'm going to turn to you. Or sorry, Philippa.
Well, I was just going to say, I mean, we have had a COVID statement or urgent question most weeks since the 11th of February, and the issue of data has dogged that. I mean, last Monday, I raised, when we had the lockdown in Leicester, the fact that England's data on the UK website was still shy of over 80,000 cases. How can you expect politicians to make decisions if they have no idea how many cases? And how do we expect test, trace and isolate to work when local public health teams are literally down on their knees begging for both the data and the actual cases so that they can contact them. I mean, this setting up a whole parallel laboratory system with no feed into NHS and no, apparently wasn't even put in the contract, the responsibility to report cases to GPs or public health teams. So data, whether of individual cases or in the round, I think has dogged this entire response.
I think we would all agree. We've just written in the BMJ an editorial about the lack of data sharing around the Leicester outbreak, which has really been shambolic, I would say, leaping out of my chair position. Dave, can I ask you, reflecting on everything you've heard and about what may be seen to be a bit of a leadership and strategy vacuum at the heart of England's response, what would you say about that?
I think that's precisely what this report is aimed at. We all believe that we understand what zero COVID means. I'm just responding in a way to what Graham Medley said. We're not setting up a target that we will fail to achieve. We're setting up a target that we believe is right for the whole country. If we go forward on the basis of the government, frankly, we're all not understanding what the strategy is. So another objective was to try and flesh out from the government a commitment to a strategy that we can all understand and can all join in. That is missing, and I think that's really why we decided this was the report for the moment.
Thank you, Dave. Gabriel, coming back to you, and then we've got a question from one of the journalists. What is your feeling about what you've heard, and does that make you feel like that certainly the people on this discussion are all on the same page? I mean, does this make you feel more optimistic about a change in direction if we could get others to join that view?
Well, I'm very optimistic because I think the public is on the same page. The public wants to say goodbye to this virus once and for all. And we want our schools open. We want all our facilities open. And the only way to do that safely is to control the virus and get a zero COVID Britain and Ireland. It is truthfully the only way forward. And I'm very encouraged. And I think I would love to see the Irish government, the Northern Ireland Assembly, the Scottish government, the Welsh government, and the Westminster government have an urgent conference to decide on a joint strategy. There is a very helpful memorandum of understanding between the Republic of Ireland and Northern Ireland. I think there could be a memorandum of understanding between Britain and Ireland, all of the administrations, to agree a way forward, because if we go in separate directions, it will fail for all of us. That's for sure. And open borders in the UK and England still having continuing large numbers of circulating cases, it will fail for the whole of Britain and Ireland.
Thanks, Gabriel. Michael, Gabriel mentioned earlier that the busiest airline route is between London and Dublin, which came as a surprise to me. I mean, that clearly creates a challenge if we don't have some sort of British Isles-wide policy. Sorry, you're on mute, Michael.
Yeah, thank you. Fiona, I agree totally. There was a huge movement of people between the Republic of Ireland and the United Kingdom, not only across our joint border between North and South, but also across the UK. So many Irish people went to and lived and still live in the UK and work in the UK. So there's a huge connection. And I think not only should there be an all-Ireland approach, as Gabriel Scally has said, but there should be an approach between the island of Ireland and the United Kingdom. But just to go back to a point which has been raised by several speakers, and that is the point of trust. And in relation to our public health advisors and our Department of Public Health, from the very beginning, they have been foremost in speaking to the Irish people. And there has been a huge degree of trust in our public health doctors' advice. In fact, our Chief Medical Officer has been nominated to be given the Freedom of Dublin for his work in controlling the virus in Ireland, which allows him to drive his sheep from one end of Dublin to the other unmolested. But from the point of view of how we have controlled the virus here in Ireland, there has been a huge element of trust between public health and the population, and also the government working very closely with the Department of Public Health. The other issue, just briefly, is how the non-health, the social determinants of health are so important in relation to education, housing, transport, social protection, and all those elements have come into play in Ireland to try and support people who have been affected by the economic decline and the recession which unfortunately is going to come. So we have to look, and broadly speaking, in global terms, poverty and health inequality are huge drivers of making populations vulnerable to the virus. But certainly the element of trust has been very high in Ireland, and I think that has really helped in controlling the transmission and getting people on board and following the advice that public health have given.
Thank you very much indeed, Michael. I'm following the chat, and Philippa, you're mentioning about the problem of zero COVID as a kind of concept, and perhaps zero tolerance would be better. Just talk about that a bit. Interesting idea.
Well, I think all of us, since the paper came out and discussion around it, and when people talk elimination, you get an inevitable wave of Twitter response suggesting you're talking nonsense. It can't be eliminated. And I think you will get that when you talk about zero COVID, and exactly as was mentioned earlier, you're kind of setting up to fail because you had one case or two cases. Whereas people do understand the concept of zero tolerance. We use it very much with regards domestic abuse. We don't think there's a date where we'll say, great, domestic abuse is finished, that the job is done. It is a constant and relentless campaign against domestic abuse. And so I think using zero tolerance for COVID means we're not accepting it. We're not kind of going, well, 100 deaths a day, that's kind of reasonable. We'll go with that. And that's 27,000 by next spring without a second wave. A second wave would be in addition to that. So I just feel we should think about using language that is elsewhere regarding crime, regarding abuse, and use it there, because it doesn't mean no cases ever. It means absolute constant battle against the virus.
Thanks very much. Susan, you're nodding just as a behavioural psychologist. What's your feeling about that as a framing of it?
I haven't discussed this with any other group before, but my instant response is I think it's an excellent idea, because it takes the widest group with us. And also it's because there's parallels, it's very easy to explain and to understand, which is what we need at this moment. Sort of maximum unity of maximum numbers and maximum accessibility and comprehension, and therefore motivation to get stuck in behind it.
Great, Gabriel. And then we've got a question from the press. Gabriel.
We had an interesting discussion earlier about numbers and testing and so on. And I like numbers, and zero is a nice number. And that's where I want to get to. I can absolutely see the Prime Minister of the UK loving the idea of zero tolerance of COVID, because it fits in with whacking moles and bashing things on the head and all that sort of rhetoric. I like a big round naught. No cases, apart from those that crop up from being imported. And that's what zero means to me.
Very good. Thank you very much. We've got Haroon Siddique from The Guardian. Wonderful. Thanks for joining us. Ask your question.
Hi. I wanted to ask you about the role of face masks, in particular, given the President of the Royal Society's comments yesterday, where he said not wearing a face mask during the COVID pandemic was akin to kind of drink driving or not wearing a seatbelt. I wondered whether there was the same kind of strength of feeling amongst the panelists.
Thanks very much, Haroon. Susan.
I think it's becoming increasingly clear that face masks are warranted and are needed, especially in indoor spaces. And I think we really need to begin thinking about how we achieve that, given there's no cultural history and there's no huge appetite from looking around from the British public at the moment. But the more we're getting an idea of the number of asymptomatic cases, the stronger the case for face masks are. We also need to think about the arguments that have been used to caution, which really comes down to helping people wear them in the right way, which means proper education, proper training, and maybe no face mask should be sold without some instructions, much like medicines are. The problem is if that people are wearing them and they have the infection, those masks get contaminated. And as you know, people will put their masks on their forehead, their neck, their chin, spread it around their face, touch their mask, then touch other things. And so, you know, a new sort of route of transmission is possible. And the other concern is that, and there is some data to support this, that those people who are wearing face masks feel falsely reassured and put less effort into hand cleaning, social distancing, etc. So we need to have a really effective and nuanced campaign to explain why face masks are important, how they should be worn. And I think we need to do it sooner rather than later as part of the new strategy.
Thanks, Susan. Ruth, what about in Wales? Tell us the face mask position in Wales.
They're not mandatory, but I think everybody's looking at the evidence that's emerging and realising that they do have benefits. And I think that's emerged much more so in recent weeks. I think the suggestion that this goes along with the wider campaign to eliminate the virus would be very sensible, not least because as we go towards winter, we will spend more time in enclosed spaces. And I agree entirely with Susan that people need to know how to use them. There's, I think, plenty of anecdotal evidence of a range of ways of wearing them and using them. And so I think if we are going to seriously get behind this, then we do need to make sure the public are fully informed.
Thanks, Haru. Thanks very much, Ruth. Briefly, Vital, anything from Scotland on face masks?
Just to say that I think Scottish Government at the moment are actively encouraging the use of face masks, and they are due to become compulsory within certain settings in the coming days. So I think the evidence certainly suggests they're helpful. Obviously, we could do with better evidence, as in many other areas, but what we currently have to work with suggests they'd be very useful.
Thanks a lot, Harun. I hope that's a good enough answer for now. I'm going to say we've got Joe Gammy from PA to join with a question, but while we're waiting for him to join, Dave, your point. Yep, we've just lost Dave, I think you. Oh, there you go, Dave, your point.
I simply wanted to come back on Haroon's question and say, for me, clarity is absolutely essential. And I would say face masks should be obligatory in any indoor situation and in buses and trains. And of course, we need information. But I would just start by saying should be obligatory, and then we need to work out the detail.
Thanks. And Dave, you've made some strong remarks in the past about what you think is unacceptable about the high rate of deaths, number of deaths. I mean, do you think the public understands what's at stake at the moment, or they're just being encouraged to be in denial?
Well, I think, to be honest, there's a vast proportion of the population who understand the nature of the challenge and understand the danger to the country at large and to themselves as individuals. But at the same time, there's a significant minority who believe, from what they have heard, and obviously their hearing is selective, from what the government is saying, that really we're coming out of lockdown, we're coming towards the end of the pandemic, and we can begin to relax. And we did see that with July the 4th pubs opening. In many, many places, people were behaving very well in the pubs, but in many other places, they were not exactly as you would predict. So I think the real question about what the great British public thinks is a more complex one to answer, because there are many different views. But let me just also say, I would have said opening pubs indoors would be the very last thing on my list of undoing as the lockdown goes, because for all our good intentions, give us a few drinks and we all tend to forget our inhibitions. And what we need are those inhibitions to remind us that it's dangerous to walk up to people and hug them and so on. And yet we saw all those photographs from Saturday night. I think it's very, very risky.
Thanks very much, Dave. Do we have Joe Gammy from the Press Association to ask a question? Not sure. When he joins, we can ask him. Con, you wanted to add something.
Yeah, just in relation to the face masks, and the situation here at present is that they're strongly encouraged to wear masks in the north. Recently in the south, they haven't made mandatory on public transport. And in the north, the executive are actively discussing a similar approach to that. Again, just with the whole common sense of traveling over an invisible border and then being in a different situation. But I was struck by a debate that I saw online last night, I think, around the issue of the spread of HIV and the spread of AIDS and the battle around trying to encourage people to protect themselves in terms of condoms and things. And the big target there, the big difficulty there was persuading people who thought they were at no risk whatsoever that actually this does affect everyone or potentially could affect everyone. So I think a lot of it has to be around education. It has to be around explaining how to use it properly, why you're using it, and what the impact of you using it could be or not using it.
Thanks very much, Philippa.
I think the making it mandatory is quite important. It's been mandatory on public transport in Scotland and becomes mandatory in shops and indoor spaces from next Friday. I don't go into shops. I leave that to my husband, but he does wear a mask. And I wrote to every supermarket in my constituency and said, you know, you're doing a great job with the 2 meters and the marking and the one-way systems. Why are your staff not wearing masks? Why are you not promoting it? And I did get really positive replies, but it was nearly all, we make them available to staff, we will promote them if they become mandatory. So, you know, I think if you were starting to get shops setting an example by their staff who are exposed to the public all day, if you start to get celebrities and others, you know, acting as role models. But, you know, as Susan and others have said, we don't have a culture of wearing masks here, and we need to get past that. So I think making it mandatory is important, but I think also is promoting it at every opportunity.
Thank you very much. We have Joe Gamley with us from the Press Association. Hi, Joe. You're on mute. Yep.
There we go. Hello. Hi there. Sorry, I might have missed the start of this, but I've been listening to what you've been saying about a zero COVID approach. But what I'm quite interested in is what needs to be done. Firstly, what would need to be done over the next few days to work towards that, and then looking to the medium and long term, what sort of steps would need to be taken to move towards that on a practical level. Firstly, what would the government need to say, but also what would our readers, people on the ground, have to do to move towards that generally?
Very helpful question. I'm going to ask Gabriel to summarise next steps in the next few days and weeks.
Well, I think the first thing that has to happen is that there has to be a discussion between the governments and administrations, the devolved administrations and the Republic of Ireland, about the next strategic direction we go in to deal with the pandemic, because there isn't a strategic direction at the moment and there needs to be agreement. England in particular needs to produce a really robust find, test, trace, isolate and support system. It isn't there yet. It is quite possible to do that and build that, and it will take a little bit of time, but it should be done and they should set about doing it now. The laboratory capacity needs to be there to make sure testing is done quickly and available where it's needed and when it's needed, and the system that we put in place for dealing with flare-ups with isolated cases needs to be tried and tested and organized so that it will snap into action completely. I think those are the key aspects for me.
Thank you very much indeed. And what about stopping travel, air travel? Michael would like to talk about that. Should we change the rules on air travel? Michael,
sorry. Fiona, were you asking me that question? Sorry.
Yeah, sorry.
Well, I, from a personal point of view and from observing what we've been doing in Ireland, I think we could throw away everything that we have succeeded in developing over the past few months if we allow free international travel. And there is I suppose, a debate between public health and medical advice, which is talking about restricting movement. There is the economic factors, which is saying, yes, we have to get back into a proper economy again. And then it's up to the politicians to put that balance in place and to achieve a balance which does not allow an importation of new cases. So I think foreign travel for everybody is going to be a huge issue. And I think it does have to be controlled and properly monitored. And if you are going to open it up, you're going to have a very effective quarantine program to prevent new cases coming into the UK or to the Republic of Ireland or any other country for that matter. So it is a huge issue, and it's one of the hot topics that's been discussed here in Ireland. And we have put off opening up our foreign travel for at least another 2 or 3 weeks while the government assesses the implications that it will have.
And Susan, what about the members of the public? What should Joe tell his readers about changes of behaviour by members of the public?
In terms of the next few days and what we're going to do. Well, I think that for the public to change their behaviour at scale and over time, which is what's needed, we have to identify trusted sources. So who's going to be telling the public what, and on what basis are they going to be telling the public? What we know is if you tell people not only what to do, but why they should do it, you explain the rationale, then people are much more likely to do it. We know that if the source of advice is trusted, they're much more likely to do it. So going back to my earlier point, I don't actually think there's any shortcuts. I don't think somebody can stand up tomorrow and say, do this, that, and the other. We need to identify whole communities that have in various ways been rather alienated, work with those communities and begin a bottom-up, consultative, collaborative partnership, whole way of dealing with this. And let's have the advice coming from those communities, from faith leaders, from other people who are respected by different groups of society, whether they're young people and it's coming from well-known singers and sports personalities. You know, do it that way. I think we've really come to the end of just having the top-down Westminster edicts as a way of changing population-level behaviour.
Thanks a lot, Susan. Vital and then Ruth.
Just to echo what Susan's saying there, really, I think the communication required at this stage is going to be very tricky and is going to require working with a lot of broader communities than has been the case so far. As well as the communication, going back to the point about needing the financial support and the broader social support for people to actually isolate when they're asked to. I think we need to make sure that system is in place so we have good systems of sick pay and other appropriate financial support.
Thanks, Vital. Ruth?
Well, just to emphasise that I agree that the support systems need to be there, and the local leadership that we have in the Directors of Public Health and their teams at local level have been working tirelessly for months now. We need to make sure they're supported, sustained, because they have the local contacts. They are the local voice that people know. They know their communities. They can identify with local authorities the supports that are needed. So I do think the practical question is, what else do they need to do to keep this system in place now for many months ahead?
Thanks a lot, Ruth. Joe, I hope that gives you enough of an answer. Very nice to see you. We're going to close in the next few minutes, but I just wondered if, Christina, watching the chat, you've been talking about the fact that it's not just about deaths, it's about illness, and let's be clear to people about the wider toll. Is that?
Yeah, I've just been saying that there's this kind of view that's most obviously expressed by, say, President Trump, where he said 99% is harmless. It's not a harmless disease. And there seems to be emerging evidence that some people have a really long form or some kind of post-COVID fatigue syndrome. We still don't know what the long-term impact is on people's lungs after they've recovered from COVID. So it's not just about preventing deaths, it's about preventing illness. And so it's not, you know, that's how you bring everyone in. Even if you're young, you may not be at risk of death, but you might still end up with longer term health conditions that you really don't want. So let's try and remember that this is an unknown disease, then it's not just flu.
Thanks for that. Anything else you wanted to add at this stage? And I'll just let everyone.
Yeah, I was just wondering, Fiona, as editor of the BMJ, what's kind of your view on the current situation?
Oh. We've sort of, hopefully the BMJ has made our view clear, and we want to be constructive, but it's quite hard to be constructive, particularly about the situation in England at the moment. And I think, to put it frankly, it has been rather shambolic, lurching from crisis to crisis. And I think, I'm sorry, I'm leaping out of my chair position here to say that I think we do lack a clear strategy in the UK. And one has to acknowledge the particular issues that are, London is huge, and we're international travel and all of that. But slow to lockdown, and the time in lockdown not used to good effect to set up a proper contact tracing system and testing system. I mean, the press has been full of the issues, and I think, sadly, justifiably, there's a lot of anger, and I think I share that. So back into the chair position quickly. Just on the last few minutes, who would like to give a last? I'm going to give Gabriel the final word, but Con, yes.
I think just in terms of the next step, I'm struck by as I often have been, by the guidance from the World Health Organization, and it might have been my fellow countryman Mike Ryan or somebody else within WHO recently who said, this is not a time to relax, this is a time to prepare. So I just think we need to keep up the vigilance, but also prepare now the next steps and be better prepared.
Thanks a lot. Philippa.
Well, I think, we all know how much influenzas, bad winter influenzas, have impacted on health and social care. We were actually lucky that 1920 was fairly light from that point of view. But if we have a combined outbreak in the coming winter, it'll be very hard to tell influenza from COVID, and you will actually have the pressure for both. So I think we have to fight this narrative of the pandemic's over. It's now 200,000 new cases a day. It's accelerating on a global level. So I think kind of making sure politicians don't get too comfy and that we don't waste the summer.
Michael, are your politicians getting too comfy?
No, I don't think so. I think we have had a very good relationship between politics and public health in Ireland. And I think that has been one of the strengths of the Irish response to COVID. There is just one other issue which hasn't been touched on during the discussion today, and that is the non-COVID knock-on effects on our health system, which are quite significant because a lot of treatment has been deferred. A lot of very serious treatment has been deferred. And we in Ireland certainly had a substantial backlog in our waiting lists up before COVID. And I just worry coming into the winter, if we have a second surge, that we are going to be overwhelmed, not only dealing with COVID, but trying to deal with the non-COVID illness that is accumulating in our society. That's going to be a huge issue because hospitals are going to have to reduce their capacity to accommodate social distancing. And with the unmet demand, I just have great fear of what's going to happen in the winter, particularly if there's a second surge.
I think we'll have the same problem in the UK. Dave, a very last brief comment before I ask Gabriel to give his final things. What do you want the government to do now, Dave?
I would like the government to respond by doing exactly what Gabriel is setting out. I don't think there is any other way forward.
Thank you. Gabriel, what do you want the government to do?
Well, we are at a fork in the road, and there are only two directions before us. One is continue the way we're going with no strategy and no control on the virus in England. And it will be a very rocky road, and the autumn and the winter may be terrible again for this country, which has already suffered so much. The alternative is that we decide that we are going to get this virus under control. We are going to eliminate it in these two islands, and we're going to do it all together. And I would very strongly commend the government to think again.
Thank you, Gabriel. Thank you, all of you who've been on this discussion. Thank you to those who've been listening. If you want to engage in this debate further on the BMJ at bmj.com, please do. Also on the Indie Sage website. And very much look forward to seeing people corresponding on Twitter. So thanks very much.